You just heard from my colleague, Laura Garricardis, on the importance of reducing the number of uninsured in Texas. And I would like to speak to you now about the same topic. First, I'd like to address that this is important for Texas children as well as for Texas adults, the ones that are in the coverage gap, those approximately 1 million adults. Anything we can do to close the coverage gap among parents has a well-documented and direct effect on children's access to care and to health. When parents have access to health care, their children receive more medical attention, such as checkups, vaccines, and screenings, and we know that healthy children learn better and achieve more. On the testimony I submitted, there are several studies that I cited indicating the advantages that children receive from early intervention and from high quantity and quality of health care. I would specifically highlight one: adults who receive Medicaid as children have long-lasting educational and wage benefits. Women in particular have significantly higher rates of college attendance and higher cumulative wages by age 28 after having been Medicaid eligible as children. On my remaining time, I'd like to turn the committee's attention to a document called Chambers in Support of Closing the Coverage Gap that should have been distributed to you. One thing that the Children's Defense Fund has been working on is keeping a running tally of all of the business organizations that are in favor of closing the coverage gap and reducing the number of uninsured. It is safe to say that there is nearly unanimous support from the business community on this issue, and I think I would urge the committee to take a look at the language that is included. The first page has a list of every chamber, and I should add that at this point it's already out of date, and I printed it yesterday. I'm getting emails from chambers on a daily basis. I'm sorry, do you not have the document? Okay. On a daily basis telling me that they are issuing resolutions in support of closing the coverage gap. If you turn the page, I have excerpted the language that each chamber uses, and am happy to put any of the senators that have interest in contact with people at those chambers who could speak to the senators or the senators' staff on that issue. In my remaining 45 seconds, I would also like to highlight a document I submitted. It's called a Health and Wealth County Checkup, and what we've done here is highlighted the counties that are in each of the senator's districts so that each senator can look and see precisely the numbers that your counties are looking at when dealing with the cost of the uninsured. For example, Senator Schwertner, in the counties in your district, you're looking at 44,000 uninsured approximately, of which 30,000 are those adults that are in the coverage gap. The cost to your counties is $48 million a year in covering the cost of uncompensated care in the hospitals. That number would be dramatically reduced by coverage expansion. In addition, those counties would see an influx of approximately $200 million in federal funding coming in. There are a number of other statistics in each one of these sheets. I've printed out one for every senator on the committee, and I hope that your staff will take a look at those, and I'm available for questions afterwards.
Thank you very much for the presentation.